All right, so classifying asthma severity and initiating therapy. So initial visit, classifying asthma severity and initiating therapy. So the components of severity will be impairment and risk, and severity stages will go intermittent and then persistent, which persistent branches off into mild, moderate, or severe. So with the symptoms portion, if you have less or equal to 2 days with symptoms a week, that would be intermittent. So 2 days a week, but not daily, would be mild symptoms. Daily would be moderate symptoms. And throughout the day, every day, that's severe symptoms. So SABA use, less than or equal to 2 days a week would be intermittent. And then it would go to over 2 days a week, but not daily. That would be mild. And then over 2 days a week, but not daily, and not more than once any day would be mild as well. Daily would be moderate, and then it goes into several times per day, and that would be severe. So interference with normal lung activity, none would be intermittent. Minor limitation would mean you'd have a mild severity. Some limitation would be a moderate severity, and then extremely limited would mean you would have a very severe severity. So lung function, so FEV 1% predicted over 80%, and the FEV ratio over 85% would be intermittent. And then the FEV1 over 80% and the FEV1 ratio normal would be also intermittent. FEV1 predicted over 80% and FEV1 over 80% would be mild. FEV1 predicted 80% and FEV1 normal would also be mild. FEV1 60 to 80% and FEV1 ratio 75 to 80% would be moderate. And then FEV1 predicted 75 to 80% and FEV1 ratio reduced 5% would be moderate as well. FEV1 predicted less than 60% and FEV1 ratio over 75% would be a severe. And then FEV1 predicted less than 75% and the ratio reduced 5% or over would be a severe as well. So risk is assessed by the number of exacerbations requiring oral systemic steroids. So 0 to 1 times a year would be intermittent. Over or equal to 2 exacerbations in 6 months, or wheezing over or equal to 4 times per last year, lasting over 1 day, and risk factors for persistent asthma equals mild. So that's about a mouthful, but that all leads to a mild severity as well. Over or equal to 2 a year would also be mild with the risk assessed there. And if these events occur more frequently and are more intense, indicate a greater severity. So all this I'm breaking down individually, but I have the graph here at the end, the chart that will kind of show it more step by step. But I wanted to go through it piece by piece before we did that. So, and here's the graph with that. You can take a look at, so on the left, you have components of control, which is impairment and risk. And impairment's broken down with symptoms, nighttime awakenings, interference with normal activity, SABA use, lung function, and then validate questionnaires. Risk is asthma exacerbations that require oral steroids, reduction in lung growth, progressive loss of lung function, and treatment related to adverse effects. And so at the top, you see well-controlled, not well-controlled, very poorly controlled, and it's broken down each of these into age brackets in between. So you have 0 to 4 years of age, ages 5 to 11, and then ages 12 and over. And it's broken down individually there that you'll see what they get mild, moderate, or whatever severe with those different limitations and symptoms, nighttime awakenings when being added, what that would lead up to.